Hi, welcome to Eight Limbs of Fury. My name's Joshua. It's good to see you. Very excited to be here today. Today I'm going to be teaching you a very beginner-friendly pranayama practice. So pranayama means breath control, breath restraint, mastery, holding. There's many kind of definitions for that word yama there. But what we're practicing is the fourth limb of yoga. And it's a breathing practice. So this breathing practice is intended to calm your nervous system, to bring a balance between sympathetic and parasympathetic nervous system, basically finding the balance between the fight and flight and the rest and digest parts of your body. So with that to say, something that you'll need today will be a bolster. I'm currently seated on one. So if you find a pillow, maybe a rolled up blanket, something nice and comfortable to sit on, and just have it nearby. And with that, let's get started. So if you are sitting on your bolster, go ahead and move it out of the way, and we're going to lie down onto our backs. So lying down on your back, you could bend your knees as I have it, or you could straighten your legs out in front of you. I honestly kind of float between the two. And we're just going to take a moment, without changing anything really, we're just going to notice where breath is at, how it feels. Maybe there's a lack of feeling for your breath. Maybe you're just noticing it for the first time in your life. Breathe in. Breathe out. And take another just regular breath here. Feel yourself. So to begin this pranayama exercise, we're going to take our hands and we're going to place them on our belly. Our two middle fingers are going to meet at the belly button. The pinkies and the ring finger is going to be open, pointed down towards your pelvis. And your thumb and index fingers are going to be open. Maybe your thumbs are just on the lower part of the rib cage. So we're going to begin by breathing into the belly, feeling it rise and lift up into our hands. And breathing out, feeling the belly fall, and our hands fall as well. Breathing in, belly expands. Hands lift. Breathing out, the belly falls, and the fingers, maybe they come to touch back towards each other. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Take one more breath and feel the belly lift into the hands. And feel the belly fall. Next, we'll place our hands on our ribs, and there's two hand positions that we could do here. We could have them lying flat, or we could have the hands turned in just a bit and have thumbs pointed towards our back. We'll just have index fingers and maybe a bit of middle finger on our rib cage here. And we're going to tune into the intercostal breathing of our rib cage. So we'll inhale, we'll feel the belly expand, and then we'll come above the belly and we'll feel the ribs expand as we reach towards the top of the inhale. And then we'll exhale, release, the belly will fall, and then the ribs will fall. Inhale, belly expands. Ribs lift. Exhale, belly falls. Ribs fall. Inhaling. And exhaling. Inhale, belly, ribs. Exhale, belly, ribs. Inhale. Exhale. Inhale. Exhale. Take one more breath. Feel the ribs expand like the wings on a bird. Next, we'll bring our hands to our chest. You could have them crossed like Count Dracula, or you could just have them placed on both sides of your chest. Fingertips are going to be just below collarbones. There's my collarbones right here, and I'm just landing right underneath there. And we're going to find a similar pattern. We're going to inhale belly, ribs, and at the very top we'll feel our sternum lift into our hands. It's sternum, our breastbone, some might call it. Exhale. That's definitely a smaller degree of movement. Inhale. All the other two areas have been pretty large. Exhale. The sternum lifting is much smaller of a movement. Inhale, belly, ribs, sternum. Exhale, belly, ribs, sternum. Take 3 more breaths. Exhale. Inhale. Feel your chest lift into your hands at the top. Exhale. Feel the hands fall at the bottom. One more breath. Exhale, release. Release your hands. You can place them anywhere that feels comfortable. And I just want you to notice the sensation of these 3 areas, from the abdomen to the ribs to the chest. And ideally, you should be more aware of them. These 3 areas have received tactile input from our hands, and so our brain is already kind of registering them a bit more. Breath in. Breath out. Breath in. Breath out. Now I want you to expand your awareness into your nostrils and feel for yourself which is the more open nostril at this moment. And I want you to roll over to the side of the open nostril. Just make your way to your side. In a side-lying position, we'll just lie there for a moment, very slowly, very meditatively. Allow any natural unwindings to happen. Maybe the spine has some movement it wants to do. Mine does. And very slowly, very meditatively, we'll make our way to a seat. And now would be a good time to grab your bolster. So find your way to a comfortable cross-legged seated position. I'm here seated in Siddhasana. You could maybe find yourself in Padmasana. You could find yourself in just a bit more of a stacked leg. You could even just be in an old crisscross applesauce. But I'm going to stick with Siddhasana. And now we're going to begin a practice of resonance breathing through both of our nostrils. And we're going to be doing it to a count of a 6-second inhale to a 6-second exhale. That might feel a little bit long for you, or it might feel short for you, but just try to stay with that rhythm of breath, the inhaling, the exhaling. And what this is doing is this is not a pranayama practice, but it's like a precursor to our pranayama practice. And it is calming our nervous system down. It's regulating the flow of air through both of our nostrils, and hopefully making our nervous system open and malleable enough to receive the benefit of the pranayama practice that's going to come after this. Cool? So on that note, Exhale your air fully. And we'll begin the resonance breathing practice. Inhaling to the sound. Exhaling to the sound. Eyes can be closed or cast downly. Breathing in. Breathing out. Nostril breathing here. Close your mouth. Tip of the tongue is resting in the space where your top teeth meet your bottom teeth at the front of your mouth. Inhaling. Exhaling. Breathe in. Breathe out. Inhale, belly, ribs, chest. Exhale, belly falls, ribs falls, chest falls. Take one breath here. So we just did resonance breathing through both of our nostrils. Now we're going to do resonance breathing through just the left nostril, and we're going to be closing off the right nostril. So I'm going to give you two options here. One, you could just do an index finger to close off the nose, or we could find Vishnu Mudra with the right hand. So we'll take the hand here. It's not the rock on symbol. We'll take the two peace fingers and we'll drop them down. And we'll bring our hand to our face like so, and we'll use our thumb to close off our right nostril. So the right nostril is closed. We'll be breathing in and out through the left nostril for 2 minutes. It's a total of 10 breaths with a 6-count inhale to a 6-count exhale. Exhale fully. Inhales begin. Breathe in. Breathe out. If your left nostril is closed, you could breathe through your right nostril, or you could use your right hand to manipulate the skin around the nose to help open the nostril. Breathe in. Breathe out. When doing this practice, it's important not to be forceful with the breath. Simply draw the breath in and let it out. There should be no constriction of your breath. We're not practicing Ujjayi here. Breathe in. Breathe out. Find space for your right shoulder to be relaxed. And sit up tall. Release the right hand. Take a breath through both open nostrils, noticing any changes that have taken place. Closing off the one nostril is a bit of soft tissue massage for the nostril, so you might feel more open on the right, which is kind of surprising, but maybe you don't. Okay, Vishnu Mudra once again. This time closing off the left side nostril with our ring finger. Exhale fully. Inhale through right nostril, begin. Straight spine, sit up tall. Find space for your right shoulder to be relaxed. Breath in. Breath out. Breathe in. Breathe out. Release the right hand. Breathe through both nostrils. Noticing any changes to your breath. To the left nostril, to the right nostril. We'll find Vishnu Mudra once again with the right hand. And this time we're going to be combining those two for alternative nostril breathing. So we'll begin with the right side closed, the left side open. And this is just an example here. We'll be inhaling through the left, crossing, switching over, exhaling through the right, and then inhaling through the right because it's open, coming up at the top, crossing, switching over, exhaling out the left, and we'll repeat that pattern. So left to right, right to left, inhale, exhale. That's why it's called alternative nostril breathing, because we're alternating our nostrils. Exhale fully, left side open. Inhale, begin. Inhale left. Switch, exhale right. Inhale right. Switch, exhale left. And again, inhale left. Exhale right. Inhale right. Exhale left. On your own. Find space for your right shoulder to be relaxed. Inhaling to the belly, ribs, chest. Exhaling, belly falls, ribs fall, chest falls. Release the hand. Breathe through both nostrils. Okay. Next one, Kapalabhati. Means skull shining breath. We're not going to take a towel and shine our heads. But we're going to be using this to cleanse our internal nadis of Ida, Pingala, and Sushumna. We'll get more into that later. This is a cleansing practice, and we're just going to take the lowest stakes version of this. We're just going to do 1 round, 10 pumps of the belly, keeping it very simple. And it looks like this. So I'm going to place my hands here to illustrate what part of the belly will be pumping. And I'm just going to show you a couple 3 here, then we'll do a round of 10 on our own. And it looks like this. We'll breathe in. About 70%. So what I'm doing there is I'm inhaling my breath, and then I'm pumping my abdomen to exhale out forcefully from my nostrils. Now, something to imagine, keep in your mind's eye, that like you got a little fly on the tip of your nose, and you can maybe kind of turn your head to go, fly, get off me. Come on, get out of here. So that's the thing to kind of picture in your head. And the forcefulness, that's how much effort you're putting into it. You go, fly, get out of here, come on. So with that in mind, we'll do 1 round, 10 stomach pumps. Not very fast. We'll take them slow. In fact, take it to your count. Don't rely on me. If I'm going too fast for you, please slow it down. If 10 is too much for you, please do not do 10. Something I got to mention here. If you're menstruating, if you're pregnant, if you have high blood pressure, and any other health condition that might be exacerbated by this, just please do me a favor, do yourself a favor, don't do this, sit this out. If anything, a hernia surgery or recent hernia surgery would be contraindicated for this practice. So anything like that, if it's questionable, just go ahead, leave it to the side for right now, and maybe just sit, watch, and enjoy. Exhale fully. Inhale about 70, 80%. Kapalabhati. Resonance breath in. Resonance breath out. Resonance breath in. Resonance breath out. So for this next one, we're practicing Brahmari. A Brahmari is a female bee, and what we're going to be doing is humming like a bee. Like kind of how a bee sounds when it's flying around. You know bees. So the humming noise that we're going to be making is going to be a nasal frequency. So it's going to be very high up in our sinus cavity. It's not coming from down low in our throat or staying here in our chest, but it's a high humming noise. And think about the word numb or yum, and that is what we're going to be finding here. Now there's a mudra that goes with this, but because this is the simple version, the most low stakes version of this practice, I'm going to show you without the mudra. It's called Shanmukhi mudra, but we're going to leave that. Maybe we'll check it out in another video here. And I'm going to show you here just briefly, a very brief practice of what this looks like so you can see, and then we'll do one together. Breath in. Hum. That was a very short exhale, very short hum, maybe lasted a few seconds here. The one that we're going to do together, I want you to exhale for as long as you can, hum for as long as you can, really let it resonate in your skull, really let it vibrate your sinuses, just really keep it high up and exhale for as long as you can. Resonance breath in. Resonance breath out. Breath in. Hum. Breath in. Breath out. And that's all I have for you. We're going to take our bolster out of the way, lie in the back, and we'll take rest. Thank you for watching this video, practicing along with me. I hope you enjoy the rest of your day. Rest for as long as you need.